Hi, good evening friends. I am Dr. Ashok Loda. I am specialist pediatrician and specialist neonatologist at Belhol Specialty Hospital, Dubai. I hope you all are doing well. You are safe, healthy, fit and fine. Friends, choking is very common. My today's topic on the talk show is about choking hazards. You will be surprised to know that according to a study in US, every fifth day one child dies of choking hazards, and in 1 year more than 12,000 cases of children are reported in ER because of choking. So you can have an idea how common it is and how dangerous it is. How to recognize choking? It can happen in my family, your family, and what should be our initial response, because the ambulance will take time to come. So those initial 4 to 5 minutes perhaps are so crucial, because we all know that once brain is without oxygen for 3 to 4 minutes, it can cause irreversible brain damage. So there are certain things which we all should know what to do, what should be our response when there's a choking at home or in any public place or in a restaurant. So friends, I have with me my colleague Dr. Shireen, who is a pediatrician. Welcome on the show, Dr. Shireen.
Hi, Dr. Ashok. Thanks for having me.
Yeah, Dr. Shireen is in my department. She is a pediatrician and she is also BLS. BLS stands for Basic Life Support Instruction, the training course. She is an instructor. So Dr. Shireen, you have been training many people, many students, many doctors all this while. Can you explain to our viewers how to recognize choking? Because it's a common scenario. You and I, whenever you're eating in a restaurant or at home also, anyone can choke.
Right.
So how do you recognize?
That happens all of a sudden, and it's actually different in adults and in children. In adults, you would see that you start coughing, but it's very ineffectual. Just like, you know, when you feel as if something's gone in the wrong way, and the more it goes on, the more shallower the cough becomes. And then there's the universal sign of holding the throat, and if you ask the person, are you choking, they will not be able to talk. They will just say with signs or something that they are choking. Then that's a different way. And then with little children, they will start coughing, but they can all of a sudden get quiet and suddenly get blue around the lips and get limp. So that is more dangerous than when an adult is choking.
Oh, so you mean small infant, they are more at risk
Yes, they are.
of going into respiratory arrest. And
exactly. Because an adult can sort of control themselves or something, and usually with an adult it's food, when they're talking or eating fast or anything.
Fast, yeah.
With the little children, they're playing around with things and you don't even know, they're so quiet.
Yeah.
when things are quiet, you should think it's dangerous.
Yeah.
And then they suddenly choke, and sometimes the mother isn't even aware of it. They're choking.
Yeah. So Dr. Shireen has brought out one important difference between adult and children. By adult, I also mean older children, and by small children, I mean less than 3 years or less than 1 year of age. So children who are less than 3 or 1 year of age, their airways are very narrow. The caliber, the inner diameter is narrow. So a similar object may not block older children or adult, whereas that can be crucial, detrimental to smaller child. In fact, that object can block the airways to the extent that child is unable to speak, unable to cough. So if there is sudden cessation of playing, roaming around, child suddenly stops speaking and suddenly falls limp, that's a danger sign, right, Dr. Shireen?
Right.
Okay, so this is how we recognize choking in older children and adults. Most of the time it happens when we are eating food, while sometimes we are laughing and eating, and that also can lead to choking. So this symptom will be cough, partial cough, and what Dr. Shireen says, that is this kind of sign. So friends, if you see this kind of sign happening and person is unable to speak and he has ineffective cough, the alarm bells should ring. Good, Dr. Shireen, you told us. Now what to do? Ambulance will take time to come, doctors will take time to come. We have with us one volunteer for you, Dr. Shireen.
We have Katrina.
So if you can demonstrate on her how to, what to do, what is it
Right,
called, and what to do.
It's very simple actually, and it's a very simple maneuver,
Sec-
which is called Heimlich maneuver, which is
Yeah.
a German doctor who he thought about it.
Yeah.
And so what he do is you usually take our hands around the person.
Mhm.
There are two ways you can do it. You can either make a fist and hold yourself, or you can actually interlock your hands together. Now you put it under the navel and towards, and you make a sort of a sweeping, not straight, not upwards, make a sweeping sort of a jerk, and you do it about 5 times like this,
Okay.
and that will help you push the diaphragm up and the lungs up, helping you to expel the foreign body, if at all.
Okay, so if I understood correctly, if you can demonstrate one more time. Katrina, I need your help for one more time. So what Dr. Shirin is doing, she is holding Katrina or the victim from behind and bringing the arms and placing it in a position which is in between her navel and the rib cage.
Right.
So the in between the navel and the rib cage, and then she is making a sweeping movement. The direction of pressure is inward and upward, inward and upward.
It has to be firm and then
Firm, yes, with pressure. Now she cannot apply pressure too much on Katrina, but if you have a live situation, yeah. So inward and upward in one movement. So it will take help of the air in the lungs.
Right.
So just I need some more time, Katrina. You can be here. So what happens next? Suppose you did, and how many times you have to do?
You can do it 5 at a time, wait and see what happens, then repeat another 5. But by that time, if it's not going to happen, the person is already starting to feel limp and all that. So we will just quietly lie the patient down and start CPR till such time that the
Ambulance arrives.
comes.
So there are chances that you will be successful in dislodging that
Most of
foreign
the
body.
time, let's say about
So,
majority of the time.
So if you feel that you're given 5 thrusts, then would you like to open the patient's mouth and check what will be the step? Yeah.
Yeah, we would, but we, as with adults and with children, we will not blindly sweep our finger
Yes.
inside, because that is something that you can actually
Push.
push the foreign
Object,
body
yeah.
inside. And with an adult, they anyway know that when
They
it's
will
coming
tell.
up. They will tell you that
Yeah.
okay, fine, it's coming up. Sometimes it just shoots out.
Shoots out, yeah.
Just like the comedy movies.
Yeah, it's maybe like a cork of a champagne bottle.
Exactly.
So,
But with adults, it's not that much. But if you find that the person is getting faint and all
Unconscious.
that, you can keep actually watching. But again, never sweep the
Yes.
finger blindly.
So viewers, Dr. Shirin has brought out one important point. If the victim or the older child or an adult will himself say that okay, I feel it, and the most important clue is a while ago he was not able to speak because that object was lodging on his vocal cords, so he was unable to speak. If it shifts from that side, comes higher up, he'll be able to say okay, I have it here.
Right.
At that time you can open the victim's mouth, and if you see an object, then only you take it out.
Right.
And make sure you don't push it inside. Thank you very much, Katrina. Dr. Shirin, this is about older child and adult. Just in case if we have a small baby, let's say we don't have a live small baby, but I have a mannequin for you. What to do if baby is one month old, let's say 8-9 months old, and mother was giving her some weaning food, and suddenly baby has become unconscious.
There's a way to do it. Usually you sit down comfortably and keep your legs slightly apart. Let the child's legs straddle your thigh, and you hold the child from the back to support the neck and the head, and you check over here the lower part of the breastbone, which we call xephisternum in medical terms. We take our fingers and we'll thrust 5 times. 1, 2, 3, 4, 5. Look inside, see if there's anything. If there's nothing to be seen, again as we said before, no blind sweeps. Then we'll hold the child from the chin and turn the child over onto our forearm with the head down in this angle, and give 1, 2, 3, 4, 5
Back
But,
blows, yeah.
You can either give it back blows if the child is. But this is very hard. If the child is compliant, then you can do it slow. It depends, and you'll do it again. 1, 2, 3, 4, 5. Turning around. 1, 2, 3, 4, 5. Usually it does work, but again you have to keep on checking the mouth
Yeah.
and seeing. No blind sweeps, and if there is nothing happening, then again we have to do CPR.
Correct. So the important, Dr. Shireen has very well demonstrated, you have to hold the baby properly. Make sure that baby doesn't slip, because baby may be unconscious. So baby should not slip out of your hands. So the grip is important.
And the legs on
You have to give support to the baby's back with the forearm, and you do the chest thrust in the front
with 2 fingers
front part.
You will do it, and
One like this.
Four,
It works
5.
same way like Heimlich maneuver, yeah.
and then
And this is the technique how you have to hold to turn the baby.
when you hold the jaw from
Yeah,
below, hold
yeah.
the child from the back,
Yes.
and then straddle the child over your arm.
Yes.
This gives you good enough force that you
Support,
can
yeah, it doesn't
go
slip
hold,
down.
Hold this, and then you go 1, 2, 3, 4, 5 like that.
Okay. So the
It
direction
has to be a
Yeah.
smooth flipping from one side.
in the beginning, the baby will either of the arm. First,
Yeah.
baby will rest on your left arm. Then you turn and let the baby's abdomen rest on your right
Yeah,
forearm.
Exactly.
And the direction of pressure and the thrust is same like adult. It is inward and upward,
Yeah.
so that the lung in the air is pushed, and it will help with the force, pushed with the force, and it will help in taking out an object. And in infant also, if baby doesn't respond, if we don't get the object dislodged, the baby child will become unconscious. So adult, older child or baby, if it becomes unconscious, then till the ambulance arrive, you have to go for CPR. In my next video, with the help of Dr. Shireen, I'll be demonstrating how to do effective CPR at home. Like I said in beginning, initial 3 to 4 minutes are so crucial to maintain oxygenation and circulation in the brain. You can not only prevent death, you can prevent the brain from going into irreversible injury. So friends, thank you very much for watching. I hope these tips will help you in avoiding that tragedy or catastrophic event at home. And if you have any questions or comments, feel free to ask me or our BLS instructor, Dr. Shireen. Thank you, Dr. Shireen.
You're welcome. Thanks
Thank
for
you,
having me.
Katrina. Yeah, thanks. You can stop it. Yeah.